Let's really take some time on the sleep apnea piece. How common is it? And it sounds like getting a sleep study is the best way to detect it, but there are different types. So let's really break this down.
Sure. So, obstructive sleep apnea, which is the most common type of sleep apnea, this one, it said that about 20 to 25% of individuals worldwide have it. Very high prevalence. And this is across the world, not just in Western countries. And a it's not a disease that only affects overweight individuals. We're seeing more and more non-obese individuals of all ages, children up into the elderly as well, affected by it. And now there's also difference between men and women here too in terms of the prevalence. So men, they have about that 25% prevalence regardless of the age that we're looking at. Women actually tend to have a lower prevalence early on, and then we find that when they through menopause, their menopausal state, the rates of obstructive sleep apnea actually go high, and then it meets up back to about that 25% as equivalent between men and women. So that's the obstructive sleep apnea, and that's one where the airway tends to get small, obstruction, which is usually in the back of the mouth, kind of the back of the throat here. And that's the one that we tend to recommend things like CPAP for, where individuals are using that machine, which is blowing air, and by using positive air pressure to keep the airway nice and open so the individual can get the oxygen from their room down into their lungs. Now, there's another type of sleep apnea called central sleep apnea. Central sleep apnea has nothing to do with airway being too small. Central sleep apnea is basically that individual is holding their breath while they're sleeping. So they're not aware that they're holding their breath. They're sleeping, but they just start holding their breath. Who might be at risk for something like central sleep apnea? Individuals who have had an insult to the brain, such as a stroke, um, another injury to the brain, like traumatic brain injury, something like that. Even individuals with heart conditions are at higher risk for central sleep apnea as well. So has the individual, do they have something like heart failure? Do they have heart arrhythmias where their heart's not beating normally? Ejection fraction. This refers to how efficient is your heart at actually pumping blood out, right? So normally ejection fraction should be 65%. So each time the heart squeezes and pumps blood, 65% of that blood should then be vacated. Ejection fraction is less than 65%, higher risk for something like central sleep apnea. Or medications is another one. Opiate medications, right? Things like oxycodone, morphine, heroin. These kind of drugs, they can also suppress your drive to breathe. This could even go even further. Medications like benzodiazepines, like Xanax, Klonopin can also increase risks of central sleep apnea as well by reducing that respiratory drive. So a lot of different things. High altitude. This is one that many individuals don't realize. So ask yourself this. When you're at high altitude, when you went on a ski trip, Colorado, did you sleep worse? If so, why? Did you stop breathing when you were asleep? Is there any central sleep apnea going on?
Okay, you talked about the difference there between men and women. What about kids? Say teens and even younger. How often are you seeing sleep apnea in them?
It happens. Big risk factors, big tonsils. Weight, of course, plays a big role. Like, check this out. When someone gains weight, we know, okay, they might gain weight in their arms, their thighs. But did you know they actually gain weight in their tongue as well? So if I got a big fat tongue, And especially if I'm now sleeping on my back, that tongue more likely to fall back and obstruct the airway. Another thing I'm seeing is there's a growing population of mouth breathers. Okay. And kids are especially susceptible to this, right? Because already they have small mouths. Okay. They're growing still. Okay. Now, if the mouth is open, if I open my mouth, that space in the back here, it's actually getting smaller. So simply sleeping with my mouth open, more likely that my airway is going to obstruct, more likely that I'm going to be snoring, and more likely I'm going to have poor sleep and wake up with the dry mouth. Very, very prevalent. And now this can set up as a vicious cycle because that individual is now breathing through their mouth instead of their nose. And therefore that air is no longer filtered, right? The nose filters the air, it warms the air, it adds humidity. The mucus has antibacterial properties. But no, if I breathe through my mouth, it's raw air going straight to my lungs. Already, I'm at a high risk of developing asthma, having seasonal allergies, and I'm also more likely to pick up viruses in the air from those around me. Now, if I have allergies, I'm even more likely to breathe through my mouth. And it just keeps going, and it just keeps going. And then we're also seeing that chronic mouth breathing is actually going to result now in a smaller mouth, a smaller jawline. Notice how today it seems like every kid needs to get braces. Every kid needs to get their wisdom teeth removed. Okay? Why is that? Other day I was at a natural history museum and I'm looking at these skulls. Man, these guys back in the day, perfect teeth, right? There was no orthodontist, right? Perfect. So we as a human species, our jaws have gotten smaller. And therefore, we are now gone to the point where there's not enough room for our teeth. So we have to take the teeth out. Our teeth are getting crowded and therefore crooked. Now we have to get braces and our airways are getting obstructed. And therefore, we're ending up on things like CPAP. So that's an epidemic, if you ask me. So mouth breathing, huge. I see this too much. Okay. And on this topic, I want to mention one thing. We as adults, if we don't get good sleep, fine. We kind of know what that might look like. Maybe some brain fog. I'm tired. I want to take a nap. I'm a lethargic. Okay, fine. But a child who doesn't get good sleep, you know what symptoms they present with? Inattention, hyperactivity, can't sit down, difficulty focusing. Those are the same symptoms as ADHD. Right? So it is now about 50% of patients with ADHD, we find they actually have an underlying sleep disorder. And so now, before a diagnosis of ADHD should be made, we should ask, how are they sleeping? Do they sleep with their mouth open? Could they have something like obstructive sleep apnea, which does occur? Remember, the prevalence, especially in boys, is going to be roughly about the same, about 25%. So it's very common, especially if that child is overweight and is known to be a mouth breather. Extremely high. There's a genetic component too. Do parents have sleep apnea? If so, that kid is statistically more likely to develop it as well. So very, very common, actually. And so I would caution, I would do it with my own kids, and I would, even for your viewers, especially those who have kids, is get a sleep study, especially before you accept the diagnosis of ADHD, and especially before attempting to take a stimulant to improve the behavior in school or something like that, because maybe just improving the sleep, that alone, a natural way to improve the behavior and outcome. Better GPAs, better performance in sports, better relationship with their peers.
So you mentioned this change historically to now with the size of kids' mouths being smaller now. What do you feel are the biggest inputs we're losing out on in the modern world that's causing that?
Now that's the question I like because we're getting to the root cause. So what can a parent do to improve this? So number one, we actually have to use the jaws. Okay, so when a child is required to chew and bite and gnaw, and I'm using these muscles right here, it's going to lead to better jaw development. And the earlier we do this, the better. That's one of the benefits of breastfeeding. When a child is breastfeeding, they have to use a lot more of their facial muscles in order to get the milk than with the bottle. So that alone requires that child to open up their mouth more and use these muscles. So breastfeeding helps. And then when the introduction of solid foods, the earlier the better, okay, usually 4 months would be the earliest. And then now we live in a world where everything is pureed for the child, pureed, right? So initially for safety, puree, but then once that kid has teeth now and they have the ability to chew, let them actually use their teeth. Okay. And so that's one. Avoiding pacifiers is another benefit. Because see, what a pacifier is going to do is this. When it's in their mouth, what position? If I literally if I were to, what does it look like if I had a pacifier in my mouth? I'm like this, right?
Elongating the face.
Elongated face, right? So now that's going to lead to a narrow palate and a long palate. So if I looked inside that individual's mouth, the arch, meaning the roof of the mouth, is going to be higher, more domed, and more narrow. So they're like this. That's setting that individual up for a small airway and more mouth breathing. And also look where the jaws are. Jaws are here instead of here. So use the jaws. Make them work for it. Breastfeeding. Limit pacifiers. And there's even, they make these devices too. Where you put it in the kid's teeth and it's like a chew toy basically for children. And I like that because again, it's going to force them to use those muscles. That's a big difference. That's the big.
Whether it be a child or an adult, we find out their mouth breathing at night. How do you feel about mouth taping?
So mouth taping, I'm a fan actually. So they say that about 50% of mild sleep apnea cases can be improved with mouth taping. Because here with mouth taping, the main idea is really, what is it doing? It's just forcing you to breathe through your nose. Okay. And so by breathing through your nose, I'm going to accomplish a few things. For one, I'm bypassing the whole mouth region where the tongue is getting in the way. It's going further back. My jaw right here is going to be more up and not sag. The more my jaw sags, the smaller that airway is back, right? And now I reap all the benefits of nasal breathing. I'm filtering the air, I'm warming the air, I'm adding humidity to the air, and my mucus is also reducing my chances of getting infection. So I get filtered air. It's literally a natural air filter for my lungs. So that's one of the great benefits too. So I tried it myself. See, I mean, I was waking up, this was a couple years back. I noticed, man, I'm waking up with the dry mouth. And this went on for some time, like consistently for over a month. And so I got some mouth tape and put it on. Consistent use. I did it for 2 months straight. And you retrain yourself to keep your mouth closed. Just like how I train myself to keep a good posture and straighten my back. You can retrain yourself to breathe through your nose. And I also hear this. A lot of my patients will say, I struggle to breathe through my nose. Okay, fair. But did you know the more you actually breathe through your nose, the more it'll open up? It will actually open up. So day one okay, maybe it was difficult to keep the tape on for the whole duration of the night. Keep at it. Next night, put the tape back on, see how long you can last. See how long you can last. It tends to get easier.
You have a great beard. I'm curious, somebody with facial hair, how do they keep that tape on?
So I actually recommend different tapes, whether or not you have facial hair or not. So the tape I got, it was actually called, it said beard friendly on it. And it really stuck to my beard. So that worked great. Of course, and so I tried the other mouth tapes. They just fell right off, or I woke up in the middle of the night and it just wasn't on anymore. And experiment a little with mouth tape. If you're gonna get it, just buy 1 month supply first. You might find if you don't like one brand, you might like another brand. Generally, I like ones that are a little stretchy. So then that way, if you gotta itch yourself like this, you know, you don't feel so restricted. So that tends to work nicely.
You mentioned there the fact that mild sleep apnea, mouth taping could help. You mentioned earlier the CPAP machine. Talk more to that technology. And then for people that's not working for, they want to try different ways to go about remedying the sleep apnea, what are other technologies in that realm?
Yeah. So remember, if someone's got obstructive sleep apnea, their airway is getting narrowed and we need to pop it back open. So we often use air. Think of it as a pneumatic splint, pushing air, opening that airway up, right? So that's the CPAP machine. They put the mask on and the air is blowing either through their nose or their mouth, or kind of like both, depending on the type of mask that they have. Remember me though, I'm a big fan of the nasal breathing. So I generally recommend trying a nasal mask first, because now it's forcing yourself to utilize the nose. Now, some individuals, there's some component of personal preference. So if you've tried a nasal mask, don't like it, fine, try a full face mask, see if you can tolerate that better. Okay. But there are other ways to treat sleep apnea beyond CPAP. So for example, they make these things called mandibular advancement devices. It looks a lot like a retainer. And what it's focused on is pulling the jaw forward. So, just a little bit like this. Again, the obstruction's usually in the back of the mouth. So these devices pull the jaw forward, opens that space up. And for mild to moderate sleep apnea, it tends to work pretty well. So CPAP, of course, is statistically speaking, if I had 100 patients and I was like, okay, which one's going to be the most effective by actually, if we look at the, which one is going to keep their oxygen high and get them to consistently breathe throughout the night, it tends to be CPAP. But at the end of the day, you have to be able to actually sleep with this thing on. So if it's not CPAP, it could be the mouthpiece. It could be just a little mouth tape. It could even be something called orofacial myofunctional therapy. Let me explain what this is. OMT, we abbreviate it. This is basically tongue exercises. Okay. Did you know, Jesse, that there's a correct place to keep your tongue?
I've heard. This is more when you're relaxing throughout the day. I believe it's up on the roof of the mouth behind the top teeth.
That's correct. But it needs to stay there even when you're asleep. And this is why we have to train ourselves. So then it becomes second nature. Okay. So there are exercises that we can do to then help maintain that position. And sometimes that in itself, if you got a mild case of sleep apnea, that can often take care of that. And it's important to teach this early on. before bad habits set in, just like how we tell our child, sit up. So I mean, I got kids myself. I notice if I see them breathing through their mouth, we immediately going to put a stop to that. Sometimes I'll even see my daughter she'll be sleeping and I notice that mouth will open up. So I'll just gently close it and she's fine. She'll breathe through her nose. Um, but setting good habits early on makes a big difference. Focusing on the tongue. There's even devices that they have made now. It's a TENS machine for the tongue. Basically, it provides electrical stimulation to the tongue and cause certain muscles to contract and strengthen over time, which is a more passive way of doing those tongue exercises. But that has shown clinically to treat mild sleep apnea as well.
I know there's these devices too that stick on the tongue and hold it forward during the night. Any thoughts on those?
Again, I mean, all accomplishing a similar concept, moving things forward to open up the space in the back of the mouth. So yeah, it could work. There's even another device that provides electrical stimulation synchronized with your breathing and moves the tongue forward. Hypoglossal nerve stimulator is what those are.
Somebody that's had a problem with sleep apnea, say for 20, 30 years, they're still pushing through the days, they're tired, but they're doing it. When they get this corrected using one of the devices you're talking about here, what's the biggest difference they notice and how quickly?
It can be as quickly as one night. I can't even count the number of times patients, I start them on CPAP. Night one, they say, wow, that was the best sleep of my life. Many times they'll say, I didn't even know what good sleep was because I've been experiencing this pretty much my whole life. So it could be as quick as that. For some individuals, it takes time to actually get used to the sensation of wearing a mask or a mouthpiece. And so they might take them a little bit longer. But generally, once that airway stays open, they get deeper sleep and they'll notice those effects pretty quickly. And sometimes the symptoms that they had been experiencing can be a little subtle. Like I woke up with just a dull headache. I woke up with this dry mouth. Or get this one, waking up to urinate in the middle of the night. The prostate gets blamed too often. It's not always an enlarged prostate. Because I mean, man's only 35 years old. It's not the prostate. You treat the sleep disorder, you treat the sleep apnea, the nighttime urination gets better. It can get better.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
This is an alarming study. If you take a group of individuals and you limit them to less than 6 hours of sleep, and you were to check their